community station. This is Bobo FM. The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Welcome to Bobo. It's Dane hanging out with you. Thank you so much for being a part of the show. I have Dr. Palmer here joining us for the show. Very special show today because we are celebrating, Dr. Palmer, should I call it International Women's, I know it's International Women's Day that we're going to be focusing on the topic, but it's the entire month, isn't it?
Yes, it is.
So we'll focus on the entire month. We'll give it all to women in the month. By the way, it should be the entire year. But
I agree.
But we won't debate on that because we both agree, obviously. But let's kick it off, Dr. Palmer. By the way, she is representing HSA. She is an employee at HSA, and we're going to be talking about International Women's Day. So first, to kick it off, what is International Women's Day, and how will HSA be celebrating this year?
Hi, good morning. Thank you for having me. So International Women's Day is a celebration globally of women. It basically celebrates the social, economic, cultural, and political achievements of women. And HSA has been commemorating this event for many years now. Starting in 2012, we had our sort of inaugural International Women's Day conference. And the idea behind it was to have a conference that was solely focused on women's health, where we would talk about topics specific to women, interesting to women, things women wanted to talk about, bringing together presenters from both within the HSA itself as well as locally on island within other organizations, as well as international speakers. The campaign theme for International Women's Day, which each year they have a theme, and this year the campaign theme is about acceleration or accelerating action. And this refers specifically to action that strives toward gender equality. The Women's Health Department at HSA then recognizes this International Women's Day by having our conference every year. As I said, it brings together local and regional speakers, even international speakers, to talk about women's health, specific topics in women's health. And this year, we're proud to say that it's going to mark our 13th conference. The only year we didn't have a conference was in 2021, and that was due to COVID.
Yeah.
We still had an event, but it wasn't a conference. And so it'll be held on the 7th of March, which is just before International Women's Day, which is on the 8th. And due to increasing interest year after year, we've had to move our venue to Indigo Hotel to accommodate all of the interest and the participants that wanna attend.
Now, you mentioned speakers earlier. I want to touch on that. Is there any speakers that you're allowed to talk about that's going to be attending the event?
Yeah, I can mention a few. So we have speakers from within the Health Services Authority, which include one of our own at the Women's Health Clinic, Dr. Colin Charles. And we also have speakers from Baptist Hospital. They have a very close relationship with the people of the Cayman Islands and have always been very supportive of our conference and of our island in general. So Dr. Troy Gatcliffe, who's a gynecological oncologist, has presented actually at every single conference since its inception. So he will also be presenting. And we have, again, other speakers from, I believe it's Total Health,
Yeah.
Doctors Hospital, different medical facilities on the island.
And you said that a lot of them will be also coming in from overseas.
Yeah, we have a few. So Dr. Gatcliffe does come from Florida. We have, I think, a couple coming maybe from Jamaica.
Yeah.
I can't remember off the top of my head, but yes, not just from Cayman.
So it's a very diverse team that's going to be coming in to speak, which is wonderful. Also, the event is free. Is that correct?
It's absolutely free. Thanks to our many sponsors,
Yeah.
we're able to offer this event free to the community. And so if I can take a minute here to just
Please.
mention our sponsors,
Absolutely.
it would not be possible without their support and their sponsorship. So the title sponsor is the Health Services Authority, but we also have several gold sponsors, which include Baptist Hospital, Doctors Hospital, Cynical, Ocean Med. Our silver sponsors are Brit K and Cayman First. And then our bronze sponsor is our Ministry of Health. The Wi-Fi sponsor is Total Health. And we also have Cayman IVF as one of our sponsors. As I said, without their help and their support, this would not be possible as a fully free event to all the participants.
Once again, you're joining Bobo, and we're talking to Dr. Palmer, who works at HSA, and we're just talking topics around International Women's Day, very big conference coming up on March 7th at Hotel Indigo. So we've been talking all the details. You do have to get registered in order to be a part of the event, and it's important to get registered. I would hate for you to come out there and be told that you can't get in, obviously, because they're following the rules of just the capacity that's allowed to be held in the hotel, because I know they're pretty firm on that. With that being said, we spoke about the conference, which is a big deal. It's just been growing ever since. It's 13 years now in the making. You guys started off in a boardroom. Now it's going on to a hotel with 350 people.
Yeah, last year we had more than 350. And as you mentioned, we started at the Hibiscus Conference Room at HSA, which is pretty tight if you've ever been there.
Yeah.
And then in 2023, because interest grew so much and the number of participants grew and grew, we had to move out to the Marriott Hotel. And then this year, because again, it's gotten even bigger, we have moved to the Indigo Hotel.
What I love is this, like, I always say this to my kids. It's a Chinese proverb that says, obviously, small things become big things, right? So the more you just progress, you keep going every single year. So definitely major props to HSA for keeping a program like this going and conferences like this, because they're very important to the women. Now, topics. If we can give some of the insightful topics that will be discussed at the event. I know there's a long list of things here. You can just quickly go through it and just identify what each of the topics will be at the event.
Sure. So before doing that, I just kind of want to give people an idea of the theme. So every year there's an international theme, which I mentioned already, which is Accelerate Action. But for the conference itself, we come up with our own theme specific to our conference. So this year, the theme is Women's Reproductive Healthcare, a collaborative approach. And going along with that theme, then we have several topics. I can't even remember the exact number, but it's many topics. So we're talking about things such as sickle cell disease and maternal health, the Caribbean experience. We also discuss things like sexual dysfunction in men and women, insights from a gynecologist and endocrinologist. We will be covering cervical cancer updates, emerging paradigms, and innovation treatment. We will also be going to mental health issues, such as women's reproductive mental health across the lifespan. We also like to give updates on the most sort of cutting edge treatments for gynecological cancers. So we will have things such as optimizing outcomes, the synergistic role of external beam radiation and brachytherapy in gynecologic cancers, innovations in gynecologic cancer screenings. So some of those seem a little bit technical, and it is geared towards the medical community, but it is open to the public. So, people can sort of look at the list of topics when they go to the website, which is www.hsa.ky, and they can sort of see what interests them. So, you don't have to be there for the entire thing. You can look at and see what topics specifically you're interested in and sort of come in and out listening to the ones that you want to listen to.
Mental health seems to be a major topic on the island these days. Very concerning, just the amount of people that's going through this journey and in silence. Can we talk more about that and just what you've been seeing at the hospital? Maybe it's not particularly your area, but just as a woman, you may have friends. You may have dealt with somebody that is going through this journey right now. Yeah.
Yeah. So mental health, like you said, it's great to see how it's becoming destigmatized.
Yeah.
Women are often made to feel like they have to sort of just do everything, multitask. They're mothers, they go to work, they, have to take care of the household, all the different things. And sometimes it's challenging, it's hard, but we're often made to feel like you got to do it. That's just what you have to do as a woman, right?
Yeah.
And it's really great, like I said, to see that it's becoming destigmatized. We're talking about it more, to say that it's okay if you struggle, if you need help, if you need support. It doesn't make you less of a woman or less of a good mother. In my specific area, I don't necessarily deal with it directly, but I have patients who come in for their wellness checkup, and they're going through things. And sometimes we have to just take the time to let them talk about what they're dealing with from the mental health point of view. And, in those cases, I can direct them to the appropriate place where they can go and get the support that they need. But I see it all the times. As I said, people don't come to me for that specifically, but it's definitely part of what people are going through, and it all walks of life. It doesn't matter who you are.
Yeah. We spoke, Dr. Palmer, before on the station that I work for the morning show. Obviously, we're on a different platform now. And I remember when I first interviewed you, I asked you, are you a morning person? And you said, absolutely. I'm up 5 a.m. every morning. Just like to get going and get a good start. I obviously do not like to, bring up my fate to a lot of people because I don't want to offend. But I find that, there was recently I was in a class for the church I attend, and there was a lot of women that was in my group. And I think we were asked that in one particular day in the week, take a break. It's good for your mental. Take a break. And we were supposed to come back and obviously give feedback on that break. What I found is there was a lot of men that said, okay, well, I'm going to take this serious, right? I'm going to take a break and chill. The women just kind of felt like they had to keep going. Is this something that is even for you is a struggle?
Yeah, no, definitely. My husband is always telling me that I need to just take a break and relax because it's gonna cause, burnout and everything. So it is like you feel responsible for a lot. You feel responsible for your family, immediate and extended in some cases, and you feel responsible for me specifically, of course, my patients, and all of that. But it is important to take time for yourself, as a woman, as anybody, but as a woman, because I think we tend to have more of that. I can't. I have to do everything. I can't take a break because it falls apart if I don't,
Yeah. Yeah.
or if I do, I should say.
It's so true. It is so true. I go through the same thing with my wife also. So it's hard for her to take a break. Even when we travel, it's like everybody else gets taken care of.
Yeah.
And he's like, well, what are you going to do for you? You know?
Yeah.
I also see sexual dysfunction in women and men. Can you give some more insight on that topic?
Yeah, so that topic is a little bit of a taboo in that people don't like to talk about it, right? Nobody wants to talk about what problems they're having or troubles they're having. And it's just to be able to start the conversation and make it not such a taboo topic, to see that there are real issues that happen. And fortunately, there are also treatments and things available to help, whether that just might include counseling and not just pharmaceutical help or that kind of stuff. But yeah, it will be an interesting conversation, as I said, because it's one of those things that we don't like to talk about. We don't like to admit that we're having problems.
Yeah.
But it is an important part of anybody's life. And so it's good to get the topic out in the open and show people what's available to help if they are going through those kind of issues.
It ties back to mental too. Obviously, you're burned out, then those are things that you also need to discuss. Labor of love seems to be like a good topic. What's that going to be about?
So even though it's International Women's Day, we don't like to leave the guys out.
Yeah.
So we always try to include a topic that will focus too on men in and how they interact with us as women. So in this case, we know that a woman being pregnant, it's a lot of focus on the woman, and because she's the one going through the pregnancy. And so the men sometimes may feel a little bit left out. Mm-hmm. So this is just a topic to talk about how they come into play during the whole labor and delivery process. And it'll be coming from one of our nurse midwives at the HSA, just talking about that, because they're the ones that are there a lot during that process, and they can see and be a part of that interaction then with men and what they do in the delivery room, how they support their partners and all of that.
Yeah. It's so good. It's so much different topics. I'm intrigued. I feel like I know it's all about women, but I feel like I want to stop by and kind of hear this to learn more about our women also. But Doctor, which topic on this list is more intriguing to you? What are you excited mostly to hear about?
To be honest, I would say uterine transposition and beyond, because it talks about the advances in gynecologic surgery. So it's so many interesting new technology or techniques that are happening. So that always kind of piques my interest to see what's happening. But also I love to just talk about specific topics related to cancer screening, just because we know that cancer is it's a big part of our life. It's a normal part of our life. There used to be a day when you could say that I don't know anybody who has cancer. Yeah. And now I don't think there's one person who can not be impacted or affected with cancer, either directly or indirectly. So learning more about cancer screenings as well as cancer treatments is always interesting, because it's good to be on top of it and the latest information.
Yeah, I just recently had a debate with my wife about cancer, and it is one of those things that a friend, or you have a friend, or you have a relatives. It's close. Everybody can have a story to tell. And, one of the discussions that we had, I was saying to her, like, just like what you said, probably 15 or 18 or 20 years ago, this wasn't one of the biggest topics, right? So I was wondering, I was just a normal conversation that we were doing in the car, and I was like, where does this come from? Is this genetics or is this what we're eating today?
I think it's probably a combination of a lot of things, right? So we know that genetics do play a role, and there are some cancers that have specific genetic links. However, I think environmental factors and dietary factors play a very big role because, as you know, our world is made for convenience.
Yeah.
The quickest, the easiest, whatever. And so that usually doesn't translate into healthy. We're talking about quick foods, microwave, processed foods, whatever is going to spend the less time preparing, fast food. And so in a world that consistently gets busier and busier, we are reaching for those things rather than sort of sitting down and trying to do whole foods made from scratch. And it impacts us. I mean, there's no denying it. It definitely impacts us. And we're seeing it with increased cancer rates, not just increased cancer rates, but increased cancers in younger and younger people.
Yeah.
There was a day when you really wouldn't see colon cancer in a young person. Yeah. I know of a young woman, she was 35.
Wow.
And got diagnosed and she passed, and this was because nobody really expected that she could actually have it. So when she was going with symptoms, it was a little bit like, nah, it can't be colon cancer.
Yeah.
But that's happening more and more, unfortunately, and it is something that we have to sort of step back and look at, in terms of improving our lifestyle, our diet, our exercise. And I mean, there's not that much, I suppose, that we can do about environmental things, but whatever we can do to reduce those risks, we have to try to do.
It's important. And also early screening, there's nothing wrong with it at all.
Absolutely.
Yeah.
Early screening is a cornerstone of survival. Unfortunately, there are not screening tests for every cancer. And so those ones, no matter what you do, it becomes a thing where it's diagnosed too late.
Yeah.
But for the ones that we can do, like breast cancer screening, colon cancer, cervical cancer, it's important to just take charge of your health. And this applies to women and men, to just do the best that you can in terms of getting the screenings that can be done, adjusting your lifestyle to try to just be as healthy as you can be.
Big one.
And I mean, we know that even doing all of that, sometimes it's unavoidable because genetics do play a role, but at least do what you can.
Such a wonderful topic that we're having. Dr. Palmer's here. We are discussing all things around International Women's Day and the upcoming conference that will be taking place on March 7th at Hotel Indigo. We got more information. We're going to take a quick commercial break, and we'll be back with more with Dr. Palmer from HSA.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
And we are back on Bobo. My name is Dane, and I have the pleasure of sitting with Dr. Palmer from HSA. We're talking about, of course, International Women's Day and their big conference that's coming up on March 7th at Hotel Indigo. Dr. Palmer, I'm just going to have you go over the details again for the conference before we move into the next question of the interview. But yeah, we would love to hear more about the interview. It is the platform that we want to get people registered and to find out more information. And for those that have never, ever heard about the conference before, maybe they've moved to the island for the first time or they just simply didn't know, let's get them registered. Let's get them signed up, especially if you're a woman and you want to take part in this to empower your knowledge.
Yes, thank you. So just to remind everyone, the theme for the conference this year is Women's Reproductive Healthcare, a collaborative approach. As you said, it's on the 7th of March, Hotel Indigo. Registration at the site starts at 7:30, but we do want you to register beforehand online. This is just for us to know numbers so that, obviously there's a capacity at the venue. You can register at the HSA website. It's www.hsa.ky. And registration does fill up really fast. Like we close sometimes within a day of it opening. And so you can go online there and check it out, register. And as I said, at the venue, we start registering just to sign in, get your conference sort of bag or goodie bag at 7:30.
Amazing. Love it. We'll give you more details. And also, we'd love to shout out the sponsors towards the end of the show. We'll go ahead and name some of the sponsors. And we'll talk again of some of the guest speakers that will be coming in and local speakers on the island. But what I want to touch on now is what kind of services does HSA offer, particularly for women, obviously.
Right. So the Women's Health Clinic at the HSA does offer a variety of services for women. It's strictly women. So at our Women's Health Clinic, we provide services that will include antenatal care, gynecologic care, and just as a note, our maternity ward at the HSA is the longest standing one on the island, and as such has welcomed generations of babies here in the Cayman Islands. As I said, we include antenatal, obstetric services, gynecological services, family planning, and parent craft classes.
Amazing. Yep. Go ahead.
So just as a little sidebar, if you're asking what are parent craft classes, parent craft classes, it's a initiative that was started many years ago at the HSA, completely free to pregnant women and their partners. It basically is geared towards answering questions that expectant parents might have, maybe first-time parents or even not first-time parents. And it includes the services of the maternity ward staff, physiotherapy staff, and dietetics department to share their expertise, answer questions for new moms. It's basically an 8-week series where a different topic is covered. So women have a big fear of labor. So they talk about what is the whole labor and delivery process. And even though we have technology at our fingertips and you can Google just about everything, this is a great setting where it's held at the Hibiscus Conference Room, 5:30 from 5:30 to 7. And it's just being in a room with other expectant parents to be able to ask your questions, get that information from experts, and just have a good sort of time learning about your time to come as a parent. It runs on an 8-week cycle. So if you kind of jumped in, let's say at week 4, you can always come back to the other ones that you missed, and you can access the schedule at our website again, www.hsa.ky.
Love it. Now, there's the name that you've been throwing around throughout the whole entire interview that I am having a hard time trying to even comprehend. I don't want to butcher it. Gynecologically, like you've been talking about that. Can you explain that to me, please?
Right. Gynecology. What is gynecology?
What is it?
So it's basically the area of medicine that involves routine physical care for women. It's the treatment of specific gynecological or reproductive system diseases. And the gynecological needs of women will change. So what might be the case in your 20s, and it's not going to be the case in your 60s. And so our women's health clinic and the team at Women's Health Clinic at HSA is prepared to support patients at every stage with these gynecological needs. And so going along with that, some of the services specific to that include, your routine screening. So well women's checkups. We have a well women's clinic where you can do your pap smear screening, you can do your breast screening examinations, blood work to check your cholesterol or diabetes screening, and just those general checkups. We also have treatment for specific gynecological diseases. So this is, as I said, specific diseases of the female reproductive tract. So this could include fibroids. We live in the Caribbean, and people may not know, but fibroids are very, very common and more common in people of African descent. Yeah. So Caribbean, you have a lot of women with fibroids, and fibroids may not necessarily cause symptoms in all women, but as women who have symptomatic fibroids will tell you, they sometimes can cause very significant symptoms related to having very, very heavy periods to the point of causing anemia in some cases. And so we offer treatments for that, which can be medical treatments, medical, surgical treatments, and just different things. We also offer management of polycystic ovarian syndrome, which is another condition that's very common in women, leading to hormonal imbalances, and as a result of that can lead to period irregularities. So we can help with those issues. And then, of course, the big C that we just talked about, which is cancer, gynecological cancers. So screening for as well as treatment for some of those cancers, such as cervical cancer.
Yeah, I see fertility counseling and management also here. Can you speak more about that? That's intriguing to me. So
while the HSA is not a fertility center or fertility clinic, we can offer some testing for fertility concerns where we can offer investigations with blood work. We can also offer investigations such as a hysterosalpingogram, which is a test that's done at the X-ray department just to look at your tubes to see if there might be a component in the tubes that's causing infertility. In addition to that, there are some treatments that we can offer to help with fertility issues. I mean, as I said, we're not a fertility clinic per se, and so we don't have the wide range of treatment that a fertility center would, but we can offer medication to help people who have ovulation issues with fertility, such as ovulation induction medication.
Yeah, perfect. Also, I know we spoke about this earlier, Dr. Palmer, but we screening is something I like to keep bringing up on the show because of our listeners, obviously. And we did say early detection is something that we want to start to focus on a little bit more earlier. It's for me, speaking from a guy's perspective, I know we're talking all things women, but I know my dad said to me that, prostate cancer kind of runs in our family because, my dad, now my uncle, and my granddad, he obviously did not catch it. It was an early detection for him. My dad and uncle did catch it early, though. They've always said to me, they always instilled to me, like, as soon as you reach 40, then you should get tested. But I don't know why that kind of stood out. Like, I should probably do it a little bit earlier. I don't know why I felt the need to do that. For women, from a women's perspective, like, let's talk breast cancer, for instance. That's the one that stands out to me right away. How early would you recommend a woman to be tested?
So there are various bodies, such as, let's say, the American College of Obstetrics and Gynecology, American Cancer Society. And so each of those different bodies would give different timelines to begin screening. I believe it was last year, I think it was last year, that everybody sort of came together and said that, okay, screening across the board, they recommend starting at age 40. So for breast cancer screening, age 40. Now, there's a little caveat there that if you have a family history, specifically a first degree relative, which means if I had a first degree relative, it would be my mom, or maybe if I had a sister that had breast cancer, then the recommendation typically changes slightly with that, where you might want to do screening earlier.
Yeah.
And just in general, it means that if your mom was diagnosed, let's say at age 45, you would want to start screening about 10 years before that. So that would actually be 35 for you instead of 40.
Yeah. All right. Makes sense. And you know what? I have been told that before. That's been stated before. All right. So we are sitting and having a brilliant conversation here with Dr. Palmer from HSA. All things surrounding International Women's Day, which is pretty exciting. They got a conference coming up on March 7th at Hotel Indigo, and we're going to talk more about that. The discussion is open. Unfortunately, we don't have the ability to take any phone calls today, but if you do want to email us, I'll provide that email soon, so that way you can send emails, and we're happy to send it off to HSA for any questions that you may want to ask. We're going to take a quick commercial break, and we're going to come back with more and wrapping things up, just to give you the event details again and more questions just around the kind of services that are offered in a particular area. And we'll name out some of the sponsors that are responsible for this big conference coming up on March 7th. Keep it locked. We are Bobo.
When you have a sports or fitness related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.
Welcome to Bobo, and you're joined, of course, by me, myself, Dane, from Stingray Media, and we have, of course, the privilege of having Dr. Palmer here, who works at HSA. How long have you been with HSA, by the way?
I have been at HSA since 2012. I had a brief hiatus in 2017 and then came right back in 2018.
Yeah, you've been there a while. Definitely been there a while. Well, congratulations on the years that you've put in and the services that you've done. And this wonderful topic that we're discussing, is there anything that we have forgotten to talk about, Dr. Palmer, that you would like to highlight?
Yes. So as we were talking about gynecology, then the other part of that is obstetrics, right? So we know about obstetrics and gynecology. So obstetric services are also a big part of services offered at the Women's Health Department at HSA. So obstetrics, in the simplest way to describe it, is having a baby, right? But the official thing is that it's medicine and surgery, a branch of medicine and surgery that involves childbirth and the care of women during their pregnancies. So at the HSA, we do offer a fairly comprehensive obstetrics program that involves patient management from conception to birth. We have a maternal fetal medicine specialist physician on staff. And so with that, we are professionally equipped to care for and appropriately manage pregnancies that might be considered high risk. Our obstetric services do include, but not limited to, having preconception care and counseling. So, for example, if you are a woman who has a chronic disease such as diabetes, it would be a good idea to sort of get some preconception counseling before just getting pregnant, because there are some things that might need to be dealt with beforehand in terms of your medication and all of that. So we do offer preconception care and counseling, as well as then once you are pregnant, the routine antenatal care in our setting. Our care is provided by our wonderful midwives, as well as our obstetricians and gynecologists. We do have obstetric ultrasound that can be done to, pick up and detect any sort of abnormal things, as well as to just document the normal development of your baby. And as I mentioned, with our maternal fetal medicine specialists, we can provide high risk pregnancy care and management as well. And one of the other services is that there can be screening done for fetal abnormalities. So there are tests that can be done to try to check for genetic abnormalities that could be present in the baby. Surgical care. So if your pregnancy doesn't go as planned and you end up having to have a C-section, that can be done by the very professional, wonderful staff in the operating room, as well as within the gynecological department. And then after your baby, because that's part of it too, right? So we offer post-delivery care and then your postpartum care, sort of around 6 weeks after you've had your baby, and then talk about family planning at that. When do you want to have your next baby, or if you don't want to have another baby soon, to help you to prevent that from happening before you want that to happen.
Yeah. You know what I love to, obviously, shameless plug. I can definitely give testimony when it comes to this area, because my two boys was born at HSA. And I remember the first time we had our son, our older son now, who's 15 years old. It was a little bit, I was nervous, very nervous. It was the experience of my first delivery. But the staff was so friendly, easy to deal with, knowledgeable, and just went through every single detail with us. Right?
Yeah.
So, and that's what I love.
Well, I'm happy you had a good experience.
We had a wonderful
experience. Because our midwives are wonderful, doctors, it's great.
Yeah. The only service I would ask you guys to incorporate is, obviously, when I got home, I didn't know he was going to cry as often as he did. So I was hoping that there was a service that we can just say, hey, you want to take him back for a while until we get on our feet here.
I'll let you know when we get that one.
It was exhausting. And don't judge me for this, doctor, but there was a time that he only slept in his car seat. Like he would only, every time we would put him in the car seat, automatically he would fall asleep, right? And at one point in the night, I got so tired that we put him in the car seat in the middle of the bed.
Oh no!
I'm holding it, and my seat, my leg is hanging off of the bed because there was no space. But obviously with our second boy, it became a whole lot easier, and he was a sleeper. He loved to sleep.
Yeah.
What type of services does family planning include? Let's go over that.
Yeah.
Really
so as I said, we do offer family planning services because maybe you're not ready to have a baby. And so family planning is the practice of trying to control the number of children in your family, as well as when you want to have them, like how to space them out by using contraception. There are various methods of contraception that are available that can help you to do this. And so the goal at HSA and at Women's Health specifically is to ensure that women are protected and empowered through careful family planning to, reduce the risk of sexually transmitted diseases, as well as reduce the risk of pregnancy complications. So our team at Women's Health at the HSA will give educational advice on all the various methods that are available, will help people to make the best choice for them. There really is no one size fits all. You have to sort of see what are your priorities, and we can help you to decide based on that what option would be the best for you. And we, give you the proper counseling of each method to say, well, here are the side effects, here are the potential risks, and just go through all of those things so that you can make an informed decision on what method or what option would work for you. Some of those methods, if I may just kind of
Yeah,
talk about them
please.
briefly, include, emergency contraception. So while that's not your standard regular contraception, there are times when things will happen. And so you have the option of getting some emergency contraception to help you through that. And then after that, if you want to go on a regular method, we have options for that as well. Something as simple as a pill. We have a variety of pills that are available. You can also do something like a patch, which is basically similar to the nicotine patch that
Yeah.
people use. You just stick it on and change it once a week. You also have injections that offer a little bit more long-term protection, where you only have to come in either every 8 or every 12 weeks, depending on what method you choose. And then longer term methods where you may not want to have another child, period, or if you want to wait at least a few years before your next child, you could do something like the contraceptive implant, which is a little rod that looks similar to a matchstick. It goes in your arm, just right underneath the skin, and that can offer you protection for up to 3 years. And then finally, we have the option of the intrauterine devices, which come in either hormonal or non-hormonal varieties, where we put a little T-shaped device into the uterus, and that can offer protection for up to 10 years in some cases, depending on which specific one you use. And then the very last thing, of course, is if you have decided, I do not want any more children and I prefer something permanent.
Yeah.
Tubal ligation is a surgery that is done, very quick procedure, as a day case, meaning you come in, you do it, you go home, and it's done laparoscopically, which means the little belly button
Yeah.
incisions. So recovery is fairly quick, and you're back to work in a shorter time. All of that is available.
And pardon my ignorance on this, doctor, but is that something, because I know women would ask that question, that's reversible?
Yes. So in some cases, it can be reversed. Of course, if we're doing it as a permanent solution to family planning,
Yeah.
we try to counsel our patients that if you kind of have in the back of your mind that you might want to reverse it, maybe it's not the best option for
Yeah.
you. But yes, it can be reversed in some cases, in most cases.
Yeah.
But there are some sort of risks to having it not be successful, if that's the right way to say it, I think.
Yeah, I think it makes perfect sense. And the reason I asked that was because I do know stories of women that made a decision at a young age and perhaps didn't really think it through, or at that time that's how they felt.
Right,
I don't want to.
right.
I don't want to
Yeah, and
obviously
things
offend
change.
anybody, but things change.
Things
People
change, life
change their lives,
changes,
yeah.
and so, it's good to have the option potentially to have it reversed.
Absolutely. And I always say you do what's best for you, right? That's why these plannings are available at HSA. Thank you so much for being a part of the show. Our time is coming to an end, unfortunately. What I do want to highlight, though, I do want to go back to, of course, the conference, because that's the big event that's going to be taking place on March 7th at Hotel Indigo. So if you could just go over it really quick again, how to get registered, details of the event, and, of course, naming out the sponsors of the event.
Right. So our 13th International Women's Day Conference, it's taking place on the 7th of March at Hotel Indigo. Registration on site begins at 7:30 in the morning, and the conference goes all the way through 4:30 in the afternoon. You do need to register beforehand online, and that can be done at our website, www.hsa.ky. And the topics, as we discuss, include topics from cancer screenings, cancer treatments, mental health, labor and delivery, specifically what the role of the partner is in that, and As I said, registration online is very, very highly recommended because, space goes really, really quickly.
Love it. Love it. Thank you so much. And did we need the sponsors at all?
Yeah, so as I said before, this conference could not happen without our sponsors. And so we are grateful for all of our sponsors that have been partners with us in this conference. Most of these sponsors have been partners year after year after year. And so our title sponsor is the HSA, Health Services Authority. We have gold sponsors, including Baptist Health Hospital, Doctors Hospital, Cynical, and Ocean Med. Our silver sponsors are Cayman First and Brit K. Our bronze sponsor is the Ministry of Health. Our Wi-Fi sponsor is Total Health. And we also have Cayman IVF as one of our loyal sponsors.
Love it. Thank you so much, Dr. Palmer, for being a part of the show today here at Bobo and joining us here at Stingray Media. And hopefully we get to see you more often. I kind of feel now with this hour that we've spent, we're friends pretty much. So.
We are.
So you're family, so you can come at any time. And we both wake up. I don't know if I enjoy it as much as you do, but I am an early riser because of the morning show. So we do focus on one thing at first thing in the morning, which we get along with. But thank you so much for being a part of the show and have a wonderful day and good luck.
Thank you. Thank you so much for having me and letting me talk about this wonderful event. I hope to see a room full of beautiful women on that day, just taking in all of the education and the learning and the fun.
Yeah, excited for it. Thank you so much. That was Dr. Palmer from HSA. Don't forget about the big International Women's Day Conference taking place once again on the 7th of March at Hotel Indigo.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6534 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
When you have a sports or fitness-related injury, trust the expertise of the HSA Sports and Exercise Medicine Clinic to get you back in the game. Our internationally trained and certified physicians specialize in sports traumatology, sports medicine, pain management, and orthopedic surgery. For treatment of common injuries such as tendonitis, arthritis, tennis elbow, rotator cuff, or knee tears, schedule a consultation with the Sports and Exercise Medicine Clinic at Smith Road Medical Center by calling 949-8600 or visit hsa.ky for more information.